One.
All right, good afternoon, sir. My name is Omar. I'm going to be your provider today. I'm just going to do a quick general assessment, okay? First things first, I'm going to clean my hands for your safety and mine. Taking a generalized assessment of your skin, hair, and nails. First, I'm going to look at your skin. Skin's intact, warm, dry, normal for race. Your nail beds are intact, no abnormal signs of cyanosis of clubbing. Doing a generalized of your hair. Hair is equally distributed, no issues or signs of any concerns with your follicles. Scalp is intact, no signs of any scarring or traumatic injuries. All right, actually looking now, I'm actually going to examine take a general assessment of your eyes. Looking at your eyelashes, they're symmetrical, no issues. Looking at the internal structures of your eyes, your eyelids are intact, symmetrical.
Sure.
Conjunctiva or pink, moist. Looking at your sclera is white, no issues. Next, I'm going to test your visual acuity. So what I want you to do is take a look at this Snelling chart. It's going to be 6 feet away from you. And can you cover one eye?
Sure.
Can you read the lowest level?
DHJBS.
All right, that's 20/40 on your left. All right, can you cover your left eye?
Yes, sir. DHJBS.
All right, that's 20/40 on your right. Thank you, sir. Now that we did that, we're gonna actually test your visual fields. So what I want you to do is follow my finger without moving your head.
Okay.
So I'm going to go in the shape of an H, okay?
Sure.
So checking your convergence. All right, now that I check convergence, we're gonna test your peripheral vision, okay?
Okay.
So tell me when you see my hands.
Yes.
All right, now that you see my hands, I want you to cover one eye.
Okay.
I'm gonna cover my left eye since that's your right.
Okay.
And just tell me when you see fingers wiggling.
Yes. Yes. Yep. Yes.
All right, now what I want you to do is cover your left eye.
Okay. Yeah. Yes. Yes. Yes.
All right, thank you so much. Now that I've tested your fields and whatnot, now I'm gonna actually examine the internal structures of your eyes. So I'm going to dim the lights. So with the ophthalmoscope, I'm gonna use my right hand, right eye to test your right eye. So what I wanna do is I want to find the red reflex, and I want to converge on that red reflex, get really, really close. Find the blood vessels in each quadrant while you look at the back wall.
Okay.
All right, now I wanna make sure I follow the blood vessels to your optic nerve, optic disc. All right, now can I have you look directly at the light?
Yes, sir.
All right, just how I'm examining your macula. All right. Now I'm gonna examine your left eye.
Sure.
With my left hand on the ophthalmoscope. All right, keep looking forward at the back wall.
Okay.
Coming in, find the red reflex, converging, get really, really close. Looking at your blood vessels in all the 4 quadrants. Following to your optic nerve, optic disc. All right. Can I get you to look directly at the light?
Yes, sir.
All right, examine your macula. All right. Now I'm just gonna do your pupil reaction, okay?
Sure. Okay.
Pupils are perla. Looking at an angle, just trying to see if there's any shadowing, anything like that, just to make sure there's not any increased intraocular pressure or any glaucoma. All right. All right, moving on. Now that I've examined your eyes, next thing I want to do is examine your ears. So first things first, I'm gonna actually hold this in my hands. I'm gonna use it quite a few times. Next, palpate your auricles. Also examine the rear and exterior features of your ear. No abnormalities, seems symmetric, no issues. Test your hearing. Can I get you to close one ear?
Sure.
All right, so what I'm gonna do is I'm gonna whisper. I want you to repeat after me.
257.
All right, can I get you to do the other side?
369.
All right, perfect. All right, now I'm going to examine the internal structures of your ear. So I'm going to pull up and back
Okay.
to straighten your canal so I can get a good visual. Little cerumen noted. No signs of any swelling or edema. Tympanic membranes intact. Conal light is at 5 o'clock position. Next, I'm going to look at your other ear. So, it's probably a little bit easier this way. I'm going to pull up into the rear.
Okay.
All right. Got a good visual there. Tympanic membrane intact. No signs of edema, swelling, or bleeding. Cone lights at the 7 o'clock position.
Cool.
While we're at it, I'm going to also check, so I'll have to put this down because we need to touch you. So I'll go ahead and just look.
Sure.
Open your mouth for me.
Okay.
All right, examining your mouth. I want you to, I'm looking at your mucosa, your teeth, your lips, your gums. Get you to raise your lips. All right, teeth are there, no missing teeth, anything like that. Can I get you to open your mouth, say ah?
Sure. Ah.
All right, you looking at your rear phalanx, your posterior phalanx. Uvula is midline, palate's intact, and soft palate moves when you say ah. Next thing I want to do is lift ah. You put your tongue out.
Yeah.
Can you lift it up? Left, right. No signs of any masses or any bleeding or any abnormalities. Now take a look at that. Now I want to actually test your any sinuses for any kind of any tenderness. Any tenderness here in your frontal sinuses?
No.
All right. What about maxillary here?
No.
All right. I'm gonna test your mandibular joint. Can I get you to open your mouth and close it? All right. Great. Any tenderness or anything right there?
No.
No signs of any crevices or any breakages there. Now that we've done that, I want to actually examine your neck. Can I get you to turn left?
Sure.
Right. Neck is in as good range of motion. Look up, down. All right. So now I'm going to test your lymph nodes. So start with your pre-auricle, posterior auricle, moving down to your occipital. Now moving under to your tonsillary, to your submandibular, to your submental. All right, I get you to look, keep your neck there, and I'm going to actually look at your superficial cervical, which is about right here. Now I'm looking at your posterior cervical, feel that. And now I want to feel your supraclavicular. Should be in this area. No signs of any swelling and did you feel any tenderness in any of those areas?
No.
Okay, great. Now I've done that, I'm going to take a look at your thyroid. So finding the carotid cartilage, reaching down, trying to feel your thyroid. Can I get you to swallow? All right, feeling the lobes of the thyroid. Those signs of, I'm feeling any masses, nodules, or anything of that nature. So no abnormalities noted. All right, now that I've taken a look at your thyroid gland, I'm going to actually do a quick respiratory exam.
Okay.
Start with your posterior lung field. So thumb up a cuss, moving left to right. All right, go ahead and auscultate. Can you take a deep breath in through your nose, out through your mouth?
Sure.
And while I'm at, I'm going to go ahead and just go ahead and listen to all your feels, starting with your right lateral. All right, I'm going to go ahead and do anterior. Do it again. All right, left lateral. Alright, I'm gonna go ahead and percuss, starting here. So, alright, doing the anterior. All right, sir. Thank you so much. That concludes my assessment.